Abby Vetch. I was in a group with Karina Timmermans and McKenna Koima, and we're going to talk to you today about influenza. Influenza is a viral infection that attacks your respiratory system, which includes your nose, throat, and lungs. It is commonly called the flu, but it's important not to mix it up with the regular stomach flu, which causes diarrhea and vomiting. There are two main types of influenza, type A and B, and they are both responsible for seasonal flu epidemics each year. For most people, the flu resolves on its own, but sometimes influenza and its complications can be deadly. People at higher risk for influenza include young children under age 5, adults older than age 65, residents in nursing homes, people with weakened immune systems, people with chronic illnesses, and lastly, healthcare workers. So at first, the flu may seem like a common cold with just a runny nose, sneezing, and a sore throat, but colds usually develop slowly, whereas if you have the flu, your symptoms happen a lot more suddenly. Although a cold can be a bother, you usually feel much worse with the flu. So some common signs and symptoms of the flu can include all the following: fever, aching muscles, chills and sweats, headache, dry persistent cough, shortness of breath, feel tired and weak, runny or stuffy nose, sore throat, eye pain, vomiting, and diarrhea. And these symptoms, like I said earlier, are much more severe when you have the flu compared to just like a regular common cold. So that's how you can kind of tell the difference most of the time. So influenza is caused when flu viruses travel through the air in droplets when someone with the infection coughs, sneezes, or talks. You can become infected with the flu virus in one of two ways. First, you can be inhaling the droplets directly, and then secondly, you can pick up those germs from an object and then transfer them to your face by touching your eyes, nose, or mouth. Influenza viruses are also constantly changing, with new strains appearing regularly. If you've had influenza in the past, your body has already made antibodies to fight that specific strain of the virus, but not a potential new one. Even though you may already have been vaccinated and had the flu, these new strains may possibly become infected each year, and they can have varied cases of severity, and your signs and symptoms can kind of be different every time. So it's important to still be leery of influenza even though you've been vaccinated, because you're still not in the clear. So for prevention, the CDC recommends annual flu vaccination for everyone 6 months or older. The flu vaccine can reduce your risk of the flu and its severity and lower the risk of having serious illness from the flu and needing to stay in the hospital. Flu vaccination is especially important this season because of the flu and coronavirus, because they both cause similar symptoms. Flu vaccination can reduce symptoms that might be confused with those caused by COVID-19. Preventing the flu and reducing the severity of flu illness and hospitalizations could also lessen the number of people needing to stay in the hospital and benefit our community. The influenza vaccine isn't 100% effective, so it's also important to take several measures to reduce the spread of vaccination, including, first, you're supposed to wash your hands. We recommend washing your hands for at least 20 seconds just to prevent the spread of disease. Second, avoid touching your face. Third, cover your coughs and sneezes. You can do this by using a tissue or coughing or sneezing into the inside of your elbow. And then it's important to sanitize or wash your hands directly after that. Fourth, clean surfaces. Regularly clean often touched surfaces to prevent spread of infection from touching a surface with the virus on it, and then your face by touching your eyes, nose, or mouth. And then lastly, avoid crowds. The flu spreads easily wherever people gather. By avoiding crowds during peak flu season, you can reduce your chances of infection. It's also important to avoid anyone who is sick. And if you're sick, we encourage you to stay home for at least 24 hours after your fever is gone so that you lessen your chance of infecting other people. During the COVID-19 pandemic, both COVID-19 and the flu may be spreading at the same time. You may be encouraged to practice social distancing and stay at least 6 feet from people to prevent infection that are outside of your household. You may also need to wear a cloth face mask when around people outside your household, which has become very prevalent in our society today. So to diagnose influenza, first your doctor will conduct a physical exam. Next, they will look for signs and symptoms of influenza, and typically they will order a test that detects influenza viruses. This test is completed by a medical professional who inserts a swab up the patient's nose, which is then taken to the lab to be tested for the virus. During times when influenza is widespread, you may not be tested for influenza, but the doctor can diagnose just based off of your signs and symptoms and how severe and sudden they have come on. For treatment, usually patients will need nothing more than rest and plenty of fluids such as water, juices, and warm soup to treat the flu and prevent dehydration. But if you have a severe infection or a higher risk for complications, your doctor may prescribe an antiviral drug to treat the illness. A common one that they prescribe is Tamiflu. And then over-the-counter pain relievers such as acetaminophen or ibuprofen can also help with your symptoms. For follow-up and prognosis, for most healthy people, the flu is an uncomfortable but short-term illness that resolves itself on its own by the immune system being able to fight it off. Symptoms usually appear 1 to 4 days after exposure, and they can last anywhere from 5 to 7 days. Even when symptoms resolve, some may continue to feel fatigued. Therefore, it's important to take any necessary medications, stay hydrated, and get plenty of rest to continue to fight off this infection and prevent the spread to other people.